tarde, good afternoon, everybody. My name is Ricardo. I'm from Brazil, and this is me about to miss a layup in a 3v3 tournament here in Brazil, and basketball has been my favorite sport. But I'm retired, and my favorite sport has became running after my cats here in my apartment. But I also enjoy a lot going and swimming in the sea and go for running every now and again. And my background is physical education and sports science. So I've been working trying to promote physical activity and decrease sedentary behaviors in children and adolescents. And this is my research group here, movement and vascular health. That's my main aim is to improve vascular health of children and adolescents and make sure that we decrease the development of cardiovascular disease. So what I'll be talking to you today is how movement can help children living with obesity here in Northeast Brazil. Next slide, please. Yeah, so this is just a quick show of where we're from. So right at left top corner there is a map of Brazil. So Brazil is Natal is a city located in Northeast Brazil. So we are a coastal city as well, like Hawaii. And here we have amazing beaches, and children here enjoy a lot going surfing. And here, very close to where I live, Italo Ferreira grew up, and he was the gold medal in the Olympics before at surfing, which was great for us. And there, like the second photo and the third photo is the UFRN, which is the university where I'm based at, is where I try and conduct my research projects. And next one, please. And in addition to these amazing landscapes, Natal as well is unfortunately got a lot of children living with obesity. So the very first row in that table there shows the prevalence of childhood obesity. And I highlighted the last two columns, which reflects the amount of children living with overweight and obesity. And the last column shows the number of children living with severe obesity. So this, in the northeast of Brazil, not the state where I'm based, has got the highest number of children living with obesity. So one of the main aims of my research is to make and help them not only decrease their BMI, which is not the case here, but try and make them more active as much as we can. So next slide, please. So I work together with this hospital here, which is the Children's Hospital Varela Santiago. And in there we have this hospital home sort of care to look after children with obesity. And here I put some photos. So at the moment, there are about 150 children who take part in the treatment of childhood obesity. And we try and make them more active in the hospital with these playful and joyful activities that we perform with them. But this is not enough, because when they go back to their houses and when they go back home, they tend not to be physical activity. So recently we had this survey using accelerometers that we measured that physical activity level. And we discovered that very few of them perform the minimum amount of physical activity that the guidelines suggest, that is 60 minutes per day. And then what we're trying to do now, and following the research that we conduct there inside this outreach project, is to try and figure out what do they really like doing in their homes. So if you can put the next slide, please. So now we're starting this research, and this is Eliette, my PhD student, and she's got like a scholarship from CAPES, and this project is financed by the Brazilian CNPq, which is a funding agency here. So what we're doing now is we're trying to co-create an intervention with these children. So we want to figure out, and this is Health Cascade, is an European adventure that has got lots of information about co-creation. I suggest you to have a look if you don't know them yet. And we're trying to do a co-creation work here and try and figure out what do these children like doing, and how they can become more active. And this is the project that we're performing now. So we're about to start the co-creation project. And I appreciate the invitation, and many thanks for having me. And this is my email at the bottom. If you want to contact, just feel free to send me an email.